Yes, kids have more free time to enjoy these summer months. We also see more trips to the emergency room, sadly. Often a hug and a Band-Aid will do the trick, but sometimes those injuries are a little more serious and need some attention. So Dr. Michael Watts is here from Lee Summit Medical Center with the top 5 things every parent really needs to know about taking that trip to the ER. Thank you for coming in.
Always a pleasure.
I know it's a busy time. So how do we know when it's really time to let the experts handle this one?
Yeah, well, number one, I mean, I definitely agree and believe that parents actually know when their kids are really sick.
Yeah, go with your gut.
Go with
often.
your gut. You know your child best. Usually when you want to go to the emergency department is when, hey, they're in some kind of distress. They can't breathe. You know, they had a seizure, they lost consciousness after a head trauma. Those are the real times you need to make sure that you're getting them to see a professional that can evaluate them in a timely manner.
And secondly, oftentimes parents haven't been there before, so how do you know which one to go to?
Sure, so there are obviously pediatrician's office first and foremost for those normal bumps and bruises, sore throats, fevers. Urgent cares are kind of that extension of that pediatric office. They're there for off hours, again, kind of minor injuries, sprains, that kind of stuff, lacerations that are pretty simple. And then obviously the emergency department, there are 2 different types. I mean, there are the specialized kinds where it's a pediatric ER.
Okay, so what's the difference with a pediatric ER and a traditional ER?
That's where the pediatric ER is those people are trained. The physician is actually a pediatric physician that they've actually done some extra training. The nurses also have specialized training.
Is that only at certain hospitals?
It's only at certain hospitals.
Who knew?
But you know, general ER, we are able to handle those pediatric kids or pediatric patients as well. Oftentimes we're stabilizing them, and if they need some kind of specialized care, we're going to transfer them to that pediatric hospital.
Okay, got it, got it. And what does a parent need to bring along with them?
Sure, anything that's going to keep the kid calm.
Okay.
And so anything that, you know, their
bring
teddy
the blankie,
bear, that electronic babysitter, the iPad.
Whatever works.
Whatever works to keep them nice and calm.
Keep them calm. And then you stay calm too as the parent,
Correct.
right?
That's always the most important thing because those kids, it's oftentimes their first time there in the emergency department. It's kind of a scary place. And so they're looking to you to know how to act. And so if you're anxious, they're going to mirror that same behavior.
No doubt. All right, you're not so scary, Dr. Watts. Thank you for
so
coming by.
Really
and for more from HCA Midwest Health, go to KCTV5.com, click on the Health tab at the top of the page, and we'll be right back.
You're watching KCTV5.